Hi. Hey, welcome to the Opioid and Prevention Misuse and Prevention Measures meeting directed for our parents and guardians of teens. I'm Lynnette Reddington, the Harvey County Health Department Director, and this will be a 1-hour informational session, with no time for live questions. Sorry about that. But we are recording this and we will post it to the Harvey County Health Department Facebook page in the near future. So we have some panelists and a facilitator, myself, and we're so glad to bring you this information. Thanks to the Kansas Department of Health and Environment Overdose Data to Action Grant, which was provided through the Centers for Disease Control and Prevention. So before we jump into the panel conversation, let me give you a little overview of Harvey County and drug misuse. So we're situated, as many of you know, as part of the metropolitan statistical area, being close to Wichita and Sedgwick County. Yet, we still have many rural areas in the county, with Reno County on our west. So this geographical situation with major highways and interstate provides a lot of traffic, which unfortunately includes counterfeit and other drugs. So through the Overdose Detection Mapping Application, or ODMAP, we are gaining information about overdoses from reports by the Kansas Board of Emergency Medical Services. So from August 2021 to September 2022, Harvey County data shows 130 overdoses, but fortunately 0 fatalities. In that period, though, we did have 4 days in April of 2022, so almost a year ago, that showed a spike of overdoses. That's about 2 to 3 cases per day, that included counterfeit oxycodone and fentanyl overdoses. So with the ODMAP information, we're able to relate these spikes to incidents that occurred at the same time frame in Reno and Sedgwick counties. So it's important to understand the current situation so that we can react as parents, guardians, and community members in appropriate ways to prevent drug misuse and assist those who we know are misusing. With that, I'm going to hand this over for Megan Smith, our facilitator today.
Thank you, Lynnette. We are so pleased to have our group of panelists today, and I'm going to let each of you introduce yourselves and just share a little bit about what your role is in Harvey County and how you serve the community. So we'll start on the end with you, Sandie.
Okay, hi, I'm Sandie Kueker, and I'm a pharmacist. And actually this year, I will have been a pharmacist for 25 years. And my husband and I own 2 independent pharmacies here, Hesston Pharmacy and Harvey Drug. And I'm also a parent of 3, I guess I don't have 3 teenagers anymore because now my oldest is 20. And so, but yeah, so very invested in the community, really care and really excited that there's parents that are interested in and learning about how they can protect their children. So thank you to the parents that are on this call too.
I'm Lynnette Hendrickson, and I've been a chiropractor here in Newton for the last 26 years. And of course, chiropractic, we look for drug-free approaches to manage pain, just the same as physical therapy, massage therapy. I have 4 children myself, ranging from 37 years old to 18 years old. So I've seen a lot of things surrounding drugs and the era that we have. And I have 2 of my children that have been very involved in STAND's organization for Teens Against Drug Misuse. And then my daughter Gracie does pageants, and she's Kansas Teen USA right now. And she also has been spreading that word about preventing drug misuse, and also getting a little bit more into dealing with mental health issues, which often precede drug misuse.
And I'm Chad Gay. I'm the Harvey County Sheriff. And I grew up in this community, grew up in Newton, graduated high school from Newton. And all my children grew up in Newton and also graduated from Newton High School. So not only, as a law enforcement officer do I have a real investment in this community, but also as a parent and a long-standing community member.
Great. Thank you all for sharing. I think that you clearly play important roles in our community, and obviously have connection to this topic in a number of different ways. So, well, let's dive in with some of the content. Sandie, from a pharmacist world, could you define for us what an opioid is and how have you encountered misuse happening from your perspective?
Sure. So, generally speaking, when I think of opioid, I think of the medications that are commonly used to treat severe pain, sometimes cough, although not ideally. And then, of course, there's different levels of opioids. The DEA has assigned them schedules, and so they number them 1 through 5. And so the smaller the number, then the more likely that the medication is going to be misused and the higher the potential for addiction. So if you have a Schedule 1, you're going to see like heroin. You know, the risk for a patient becoming addicted to that is so great that even though there may be some medical uses for it too, it's just too dangerous. We're not going to see the benefit to the patient. And my husband and I were talking about this question, and he had such a great analogy. So for the record, I'm giving the credit to Adam, but it was great. So he was talking about his saw his power saw that he has out in the garage. And he said, you know, this can really be amazing to help me when I'm working on a project. Like right now, we're remodeling our pharmacy. So, you know, having the power tools are great. But if you misuse the tools and you don't follow the instructions or you don't know what you're doing, you can easily harm yourself or harm another person. And so that's really what I think of when I think of these medications. There's a definite place where they can be used correctly, but one wrong turn and misusing them, then you can have a lifetime of consequences. And so that's one of the things that I hope that we cover today. And then the second part of your question was, how have I encountered misuse happening? And so I want to just explain a little bit about how the opioids work, because for me, I've always taken the approach with patients to explain why and how, and then I can lead into where we might see the misuse. So I'm going to use my hand as an example. So in our bodies, we have receptors. And so what happens is when we're in pain, then our body naturally activates the release of endorphins to help with the pain. And so what we found, hundreds of years ago they discovered, is that if you use, at that time they were using opiates, if you used an opiate to hit that receptor, then you could get pain relief. And so if we're using them appropriately and we come in and we hit that receptor, let's say someone's been in a bad car accident and we want to get them out of the excruciating pain so that maybe we can do a treatment with them or do physical therapy or something. So we want to go in and just press on that receptor just a little bit to take the edge off of the pain. What happens though is when we do that, sometimes we activate other responses too. So sometimes we'll get a release of endorphins, and so the patient might actually feel euphoric or feel high. And so I'll use an example of a teenager that goes to a party, and since this is geared at parents. So the teenager might go to the party and their friend is like, come on, try this. And so they're feeling socially awkward. And so they decide, okay, what's one time gonna hurt, right? So some teens might take it and it touches that receptor and they don't feel anything at all. Another teen might take it and it touches that receptor and all of a sudden they feel relief from the anxiety that they had and they feel good. And the problem is you never know which person is going to be which. And so what happens then in some patients, they're going to keep trying to touch that receptor. And what ends up happening is that it gets touched too much by the drugs. So you guys following this? Is this making sense? Okay. Mm-hmm. It gets touched too much by the drugs that it can't get back to the normal state. So what happens is then this innocent person, all of a sudden, because of thinking I can just try this one time, all they can think about is how they want to hit that receptor and they want to get that good feeling again. And the more they do it, the farther away they come from their body being able to reset on its own. And so then what we've done is we've produced the addiction. And so hopefully this helps to explain that. But what we'll see in our community is I have seen kids that have gotten into that situation. We work with a lot of the treatment facilities in the area. And so it's really hard for the person while they're trying to reset that back up, because basically they have to be missing that homeostasis and feeling like everything's okay. I've also seen it in patients that maybe they had a procedure and they were using the pain medication. And like I said, you never know which person is going to have that high feeling too. And so they were worried that they were going to be in pain, and no one taught them to just take the tiniest dose that they need to take the edge off the pain. And so they push that receptor a little bit too much, and they find themselves wandering around wanting to get more and more of that. So did that answer
It's very
what an
helpful.
opiate is, at least for me?
Yeah, that's great. Thank you. Building on that, Dr. Hendrickson, could you share a little bit, taking things a step further of the risks of opioid misuse and some of the things that you see and the risk factors in that?
Definitely. Well, there's some primary risk factors for opioid misuse. And the first one being past or current substance misuse. Well, with teenagers, obviously, they probably haven't used many things, but maybe they had an injury or an accident or got their wisdom teeth out and started out taking those meds. The second thing is just untreated psychiatric disorders and things like depression. Those people are more likely to misuse. Younger aged people, because they don't understand the effects. And then if people around are a social or family environment where they are seeing that misuse is being encouraged, whether adults in the home are drinking or using medications, or possibly older siblings. And then I also kind of want to talk about some of the risk factors, like what it does to the body. As Sandie said, binding to the receptors in the body, there's also not just receptors in the brain, there are other receptors. So, it's either keeping neurotransmitters from being released, or it's causing others like dopamine and the happy feeling receptors to be activated. And these things affect so many parts of the body. People don't understand. So your nervous system is what controls and coordinates all of your body's functions. So when things go wrong there, you can have problems with your heart, your cardiovascular system, your endocrine system, that's all your hormones, your immune system, your GI system, your respiratory system. If they're used with other medications like acetaminophen, then you're talking about it affecting the liver or the kidneys. And long term, now you're having a factor, or an increased risk of fractures, of infections, of heart problems, bowel dysfunction, sleep disordered breathing, along with, of course, overdose and mortality. The biggest thing with kids, though, is that their brains are just developing. So anything that alters the brain is going to alter many other factors for that child in just their ability, not only their physical body, but their emotional and mental body to function. And I can relate to this on such a personal level because I have a family member who started out as a preteen taking antidepressants for anxiety about going to school, which later turned into drinking alcohol, doing other illicit drugs. Then in adulthood, happened to have an injury, was prescribed an opioid. And pretty much from that point on, it was just a downhill slope. So she was on multiple medications. So she was taking medications for depression and anxiety, taking medications for pain, and she was not taking them as prescribed. She was misusing them, taking handfuls at a time, went through other serious injuries and accidents, along with some overdosing. And later in life, after she kind of got a handle on things, the problems became more, not that she was at risk for having an overdose, but now her heart and her kidneys were not functioning properly. And she did have lots of fractures. And sadly, she died at the age of 50, not of an overdose, but just the chronic effects of misusing those medications.
Thank you for sharing that really personal story. Really demonstrates the seriousness of the topic. So thank you for sharing. This is for all of our panelists. What opioids are the most commonly used in our county? What are you seeing most often here?
Go ahead.
Well, yeah, from my perspective, it would be prescription opioids, I think is what we would see more than anything. Fentanyl, heroin, those drugs. We're not seeing a ton of that in Harvey County yet. We are seeing some. We're seeing more than we saw a year ago, specifically the fentanyl stuff. But I would still say the prescription stuff is going to be the most abused thing that we're seeing.
In the pharmacy, you know, of course, we're just seeing the legal, the legal medications, at least we hope. No, we do a lot of things to make sure that, you know, but we monitor our patients. The state has a great resource that they put into play. I can't even remember how many years it's been now, but it's the prescription monitoring program. And so when a provider sends us a prescription, then it used to be that we would get the prescription, and the only way that we would know that the patient had already filled the same medication somewhere else was if they happened to have insurance, and we'd get a rejection on their insurance. We didn't have any real way of monitoring that. I can share a funny story. My husband and I were both pharmacists, and we were working in Wichita, and we were working at two different stores. And one morning I had a patient come through, and she brought a prescription to me for a pain medication, and I ran it through her insurance, and it rejected, that said it was refilled too soon. So I told her no, and so she asked for the prescription back. And this was before there was so much awareness. So I gave it back to her. Well, that afternoon I needed to come fill in at my husband's store. So I was working in the afternoon at another pharmacy, and the person came through the drive-through with the same prescription and said, "Oh, I don't have insurance." And I said, "Are you sure? Do you remember me?" So we didn't have the way to protect the patient from herself. And again, you know, she was addicted. And so I view this as my role as the pharmacist is to help protect the patient from harming themselves. And so now we have what's called the prescription monitoring program. And so when we get ready to fill a prescription for any narcotic, we will go in and we can check, and we can look at the patient's history. We can look at the prescription itself and see, you know, is this an appropriate dose? What is this being prescribed for? Did the doctor put a diagnosis on there? And we can see if the patient's been using different pharmacies and different providers, and look for some of those red flags that maybe the patient's got themselves in a situation where, like I was talking about earlier, you know, we have a problem here, and we really need to reset. So, but again, here, what we're going to see in our pharmacies is we're going to see the patients that have a legitimate prescription, and just really watching to make sure that we help them protect themselves.
And to add to that, even with legitimate prescriptions, this family member had multiple, but because she wasn't taking them as directed, she was running out.
Yeah.
Like a week and a half or 2 weeks prior to being able to refill. And so then they start getting desperate and looking for things they can get on the street, or mail order was a big thing she would do. And I don't know how people get away with that, but you know, other countries would send the meds without even a prescription sometime. And I don't know how that happened, but it did.
And I don't think,
Go ahead.
I'm sorry.
No.
I don't think we're necessarily seeing like pharmacists or doctors overprescribe. I mean, that's not what I'm talking about. I'm talking about, I go in, you know, I'm the grandkid, and I go into my grandparents' medicine cabinet, and I steal their pills. And so I mean, that's, I think, where the majority of what we'd see on the street for sale, because it's a pretty lucrative business to sell prescription medication. I mean, those are, you know, highly sought after and expensive. And so people are making a lot of money, you know, because it's, you know, there's no overhead, right? Because I'm stealing it from somebody and then I'm putting it back and I'm putting it out on the street. So I'm not, you know, I'm certainly not saying that, you know, that, and I think there probably was a time when there was some over prescribing, but you're right, there's a system now in place to help that, but
And there's a couple of other things that have recently changed even in the last couple of years. So Medicare, a lot of patients that have Medicare insurance, so the grandparents, they are now requiring if a patient is opiate naive, meaning they haven't had a recent history in the last 3 months of taking a medication, instead of dispensing 100 pills to them, they limit us to dispensing a 7-day supply, which is great because then the patients usually are just using it for something acute, and then you want to add in the physical therapy or other changes, that you don't want this to be your solution to your pain for the rest of your life. You want it to be something to get you through, a very short period of time. And so another component of that is the mandatory electronic prescribing. And so they're moving towards requiring the providers that are writing the prescriptions to send them electronically to the pharmacy. And just yesterday, it just revalidated why that's important. So we had a provider that had a waiver that wasn't from our area. The patient had gone for a surgery, and the patient was getting a pretty large quantity of tablets. And, I didn't want the patient to get that many, and we talked about that, and they made a good decision not to, but the provider had written for more because with these types of medications, the pharmacy can only fill out the prescription one time. And so if the patient was going to need more, they were going to have to go clear back to the surgery center. But now most providers use electronic prescriptions, and it's great because we can do a short supply. And then if something happens that the patient does need more legitimately and it's, necessary, they can just send us another prescription and the patient doesn't have to drive somewhere. So there's lots of things happening in the background that when the rules first come out, even myself, I'm like, why are they doing this? And then I realized, wait, this is a really great idea. So, there's a lot of things happening to help protect our community that we don't even realize.
Yeah, some important safety nets to make sure, different areas and disciplines are covered. Yeah, that's helpful to share. Sheriff Gay, would you share a little bit about some of the consequences your office sees as a result of opioid misuse? What does that look like?
yeah, so the ultimate consequence obviously is the deaths that we've seen from overdose of it, and specifically fentanyl. We're seeing, you said, a little more of that. We're not completely falling apart as a community, yet, and I hope that it never gets to that. But it's certainly that would be the ultimate consequence that we're seeing people overdosing. We had on the west side of the county, we had a person overdose. They went out, Narcan saved her. A week later, same thing, overdosed. We went out, they Narcan saved her. And so I suspect, that we're not getting all of those either. So there are going to be people that overdose and live through it and don't ever call us that we ever know about it. Obviously, some of the other consequences that we're seeing is arrests. It's a felony to possess, to be in possession of opioids. So, that's a consequence that would change your life for sure, is getting a felony on your record.
Well,
Yeah. Go ahead.
I was gonna say, a lot of times the accidents and the injuries that happen because of that, the falls and car accidents,
Yes.
and up into, I don't even know what the rules are now, but back in the day, people wouldn't get in trouble for driving under the influence of a prescription that they had legally obtained. But, obviously if they were doing heroin or something like that, it would be completely different.
Well, and that's changed now. If you're under the influence of anything, we can get you for a DUI, right? Driving under the influence. And we have one of my deputies is a drug recognition expert. They call him a DRE, and he does a bunch of schooling to do this thing. So he's looking at physiological things that are going on with your body that are caused by specific drugs. And he's a pretty busy guy. And, like if we make a car stop and we think that they're impaired, but we don't smell alcohol, we, do a preliminary breath test or have them blow, and they blow negative, for alcohol, we'll call that deputy out, and he comes out and does some specific things for us. And he's a pretty busy guy. So that does happen quite often, where you get a DUI based around your drug use also.
Oh, yeah, and I know we did some different studies with part of the Harvey County Drug Coalition for the Drug-Free Youth. And I know in 2020, everything practically was up through the roof. You know, the use of alcohol, drugs, and the good news is in 2021, many things were down. And I think it is because of the different things this community has tried to do to combat that problem. And that's encouraging to me.
That's kind of a good segue. You know, we've kind of talked broadly, but when you think about what parents could do, I mean, you all said that you're parents, and what things specifically should parents be thinking about or be aware of when it comes to opioid safety? We've touched on a little, but could you expand on that as a group?
You know what, I'm sorry. One of the scariest things for me is the kids that choose to use, right? I mean, obviously we would try to convince our kids that, you know, any drug use is not good, but kids that choose to use and maybe they are buying a couple of pills from somebody that's taken, like we talked about earlier, but they look like a prescription pill, but they may not be. You know, they may be fentanyl pressed into a pill that looks like a legitimate pill, or fentanyl laced marijuana. We've seen that. And, you know, they try it once and it kills them. I mean, that's a huge, you know, concern for me is the fake things out there that kids would be getting a hold of. Yeah, see, when she's putting it on the video there. You just never know what you're getting anymore, because the folks that are manufacturing these things, they're selling, you know, marijuana laced with fentanyl or pills that are fentanyl pills that they're supposed to be something else. They're not chemists. They're not the geniuses in our society. Typically, they're making, you know, in some sterilized lab, and they're making, you know, some pill in there that's going to really do some great things for you. A lot of these, you know, a lot of the fentanyl stuff we're seeing is coming from some disgusting lab in Mexico that these folks are making, and you just never know. One pill might have a, you know, a really small dose of fentanyl, and the next one is going to kill you.
Yeah.
So those are really the things that scares me about what's going on right now.
Well, and I think parents would be shocked at the statistics. I was looking up some of the facts, and 1 in 4 teens report misusing prescription at least once. 2 of 3 teens are using pain meds say that they got it from a friend or a family member. And then a lot of teens share, like you were saying, it's a big market. They share or they sell their extra pills that they took from their friends or family. So I think we're kind of segueing into, you know, how you safely deal with medications. You have anything else
This
to
is
say?
my area. Okay. So actually we worked with is it, do you say DECA or DCCA? DECA a few years ago, and we acquired these little bags. And so when we counsel patients, especially if we have a kiddo that comes in that they're having their wisdom teeth out and the surgeon's giving them a few tablets, you know, most kids, they're either not going to need it at all if they use plenty of ice packs and treat it, or they're only going to need a dose, just 1 or 2. So we'll encourage that, you know, if we see a prescription for more than 10 or 12 tablets, no way. And even that seems high as I'm saying it. But then we encourage the parents, get rid of those. You know, when they're done, we don't need to save it for 2 or 3 years later when little sister is going to have her wisdom teeth out. They're not very expensive. Let's just get rid of them. And we teach them how to use the bags and get rid of the medications. Same thing with grandparents. We talk to them, you know, if someone's having a knee surgery and they're getting a pain medication, let's just fill a really small quantity of these. And then, and we'll let the doctor know that you didn't get the whole prescription. And then let's take one of these bags and get rid of these. You know, it may not even be your child or grandchild that's the one that gets into the medicine cabinet to take them. But no matter whose child it is, do you really want to be responsible for, you know, kids grabbing that? I mean, kids make poor decisions. Like you said, their brains aren't developed, you know, so let's set them up for success. Let's just not have that in our house. And we really try to drive that message home when people are picking up the prescriptions. And yeah, and so I think I was gonna talk about Oh, you talked about the Narcan a little bit.
Uh-huh.
And I remember when that first came out, and I just wanted to make sure that the parents understood how that works too. Because I remember when that first came out, there was a big uproar about, what do you mean we're going to have this available to help with overdose? Everyone's just going to go out and do drugs, and we're going to see, the abuse go up from this. But and I'm sure you've seen this before, but you've actually probably seen it in person, and I just know the theory behind it. But what happens is, you remember the receptor that I talked about earlier, and we're pushing on it? Well, we pushed it too far that we're getting to the point where we're not breathing. So we're going to come in and we're going to put something else over that so that we block the opioid from being able to, trigger that response. Well, what happens when that gets blocked is the worst crashing. So as high as someone might feel from taking it, think of the equal and opposite reaction of feeling as low as possible. And so, so typically someone that's abusing, their Narcan nasal spray or their naloxone is not their favorite thing to hear about, because it makes them feel just horrible and awful. And the other thing to remember is, it just blocks it for a little bit. And so I visited with EMS before, and sometimes, they'll have to administer another dose depending on where the patient's at. And so, if for some reason someone's listening to this and they're in a bad situation, I hope that they get help so that they're not in that situation anymore. But if you do use that, you need to call 911, because you really don't know where your friend's at, and they could, it could happen that they, it gets found again and they go right back down and they have the severe respiratory depression. So that's exactly your question, but I thought people should know
Great.
that.
Yeah, that's perfect. That's the kind of information we need people to know, for sure. Lynnette Reddington talked a little bit about some of the challenges from a geographical standpoint that Harvey County faces in relation to this topic, but what other challenges in relation to opioid misuse do you think that we have now to combat, but that we need to be thinking about for the future too, and just being aware as parents and guardians?
Well, I think we are such a quick fix society that instead of doing the work to actually achieve the result we just want to take a pill for everything. And, being a chiropractor, we look to the root cause of people's issues. And I think people need to find a way to manage their musculoskeletal issues, because pain meds are intended for short-term use, right? You've been injured, you just had surgery, you had your wisdom teeth out, or you had some sort of surgery, and that's the appropriate use of them. But looking to take a pill for every little symptom that we have isn't going to honor our body and help us function better. Right?
And
There's so
for
many
the
other
record,
things.
I'm a pharmacist, and I completely agree with you. Completely, that we don't want to be putting this Band-Aid over. We need to figure out what's causing the pain, and really these medications they should be used short term. Now, there's some situations where, a patient may, have maybe terminal
disease.
they could be, or a hospice patient. In those situations, we're trying to make sure that the patient is comfortable and, and in that situation. But, if you're younger, let's try to find how we can heal the body in other ways, because the pain medications aren't healing the body. They're just masking something.
Exactly. And then you set yourself, setting yourself up for addiction. I had read a study that not only do those receptors need more stimulation, that your body actually makes more receptors the more pain meds that you take. And that's why you're addicted, because your body is craving it. And so I thought, wow, that's a bad situation. But again, my mom went through terminal cancer, and I was so thankful that she had those meds to make her comfortable. But when she died, we had fentanyl patches, we had morphine, we had, because she couldn't take anything by mouth at that point, and they had shifted everything over to IV. And I mean, you got to do something with all those meds, because guess what? Someone someone can take them and use them and die from them. They wouldn't even realize how dangerous those patches could be if you put more than one of them on at once. So
I'm glad you guys have the take back
Yeah, I was
day.
sure.
Oh, yeah.
Can you
Yeah.
talk a little bit about what if people can't fit it all in a small pouch, like they have a lot, is there a place that your team has they can bring items?
Yeah, so twice a year in the spring and the fall, we do it's a National Drug Take Back Day. And I've hosted that since I've been sheriff, so for the last 6 years. And we do it at the lobby of the law enforcement center. And we'll take whatever you bring in. I think needles, and they don't like needles, and they don't like the little inhaler things because they incinerate them and they pop. And I think it freaks them all out when that happens. So they don't like those things in there, but other than that, though, yeah, we take pretty much everything. Also, though, Newton Police Department, every day will take, typically it's smaller quantities that they'll take, but they bought a burn barrel and it's out in our Sally Port of the jail that they burn, they get a certain quantity of those and they burn them. So you could always take up smaller quantities up to the Newton Police Department to get those disposed of. But we probably do 110, 120 pounds a year or a session, so a couple 100 pounds of drugs a year that we take off the streets with the drug take back day. So
Do you feel like you can keep up with the volume that's brought into? I mean, it's never like as many people as want to come and get rid of them. There's
yeah,
never
we'll
an
take
issue.
as many
Okay.
as many that come in. And when I first did it, so T. Walton was the sheriff before me, and he used to do it, and then he quit doing it the last couple of years of his term. And then the first time I did it after that, I think we had 400 and some pounds, and it was crazy. One of the kids that were helping me, we get kids from Newton High School to come help, and the stand group has been really helpful. I've got to hang out with your daughter a couple times, but one of the kids that were hanging out, their parents worked over at the bank across the street from the law enforcement, first bank at the time, and she had to go over there and get boxes and come because there was so much. The volume, I mean, you imagine 400 and some pounds of drugs. It sounds like a lot, but if you look at the volume of that, we're talking pill, it was crazy. So,
Yeah, because pills are small, so it
Yeah.
that's
you
a
imagine how
lot.
many of
Yeah.
those it takes to make 400 pounds. So
Right.
it was pretty cool. And again, I'm happy to do it twice a year.
Well, and if in between times, if people need one of the little bags to get rid of a small quantity, they're welcome to come by either Hesston Pharmacy or Harvey Drug, and we have those available.
And those you put the drugs in there. And then
Yeah,
you-
so they're a
some
little
solution or
pouch.
something.
And they have a little, the magic tablet down in there. And so you put the pills down in with it, and then you add water, and it basically disintegrates it. And if someone had a
You
large,
just throw it in the trash.
and then you can just throw it in the trash because it's basically ruined it. And so if someone did have a large quantity that they had a family member and they were cleaning out the house and they really wanted to get rid of it, these wouldn't be free, but we can order in a large pouch. But the other ones are free, so someone can come and get. We want that to be off the street, and so we can give them several if they need to. And really, there's a lot of space in there when you're pouring pills down in there.
don't flush them down the toilet.
No, do not flush them in the toilet.
People don't realize that those get in the water supply and a lot of that stuff can't even be filtered out. I have heard that if you can't get someplace quickly to put them in coffee grounds.
Or if you have a Tide laundry, or not Tide necessarily, but a laundry detergent that's liquid, the container and putting them down in there and then adding some water to the soap, that'll make it but ideally I would prefer that someone, if you're talking about a regular medication, that might be appropriate, but the narcotics, it would be better if they just completely dissolve them. But that is another option if they need to. In between the take back things.
Yeah.
That's great.
It's so great you do that.
I want to go off script because I want to circle back before we have our final question. And Sandie, this might be specifically for you, but we talked a little bit about the danger of manufactured drugs. I know now in this day and age that we live in, it could be a temptation to go on Amazon or wherever. And Lynnette, you touched on this too. Sandie, can you just talk a little bit more about why there is a lot of risk in doing that? Why it might be tempting, but there's a lot of risk.
So, well, let me try to answer it by some of the rules and regulations, and some of these are actually still coming down the pipeline. But in our country, there's a lot that goes into a manufacturer being able to be approved. They have to, have their license, and then they have to prove that the products that they're making. A few years ago, they introduced a new law that basically traces where every single pill, every lot, every batch, all along the way where it is until it winds up in your bottle. And so we're now getting to the very last phase of the into your bottle. And so we're actually, the rest of the law goes into effect here. I believe it's in November. If this is being recorded, please don't just double check me, but it's in November-ish. And because it doesn't matter, I just have to do it as they tell us. But so what'll happen is on every bottle that we get from our warehouse, so the drugs are made and then they're shipped to a wholesaler. For the most part in our country, we don't buy directly from the manufacturer. There's a wholesaler, and then the wholesaler distributes them out to the different pharmacies or to the hospitals or the clinics. And so when it leaves the wholesaler, it's at this point, they already know everywhere that every single pill has been. And now they're going to complete that circle, that step, and it will be that when they send it to us, we'll scan it in to show that we received that pill. And when we get ready to dispense it to a patient, we've been installing new scanners. There's a special barcode on the bottle, and we'll be able to keep track of. So the other really cool thing is this isn't just with opioids. This is with all the medications. And so it'll be really cool if there's a drug recall, we will know exactly who has that pill. And I just think that's amazing. When they first announced it a few years ago, I was like, how in the world are we going to keep track of all this? We're going to spend all our time keeping track of pills. But the people that are in technology, they know what they're doing. And so they figured out how to make it so we can scan it. And so I really think we're going to see a lot more safety happen. Now, what are you going to do if you're someone that's buying something on the street? Obviously, they're not going to have a scanner to make sure. But so just don't do that.
Right. Yeah, it could be really tempting for numerous reasons. Cost, maybe it seems easier, but to Sheriff Day's point, you just have no idea what one little pill could contain and how risky that could be.
And so sometimes people complain that medications are more expensive in our country, but that safety, if I'm thinking of my family member, I want them to have all those rules and regulations. I don't want it to be a free-for-all that things are getting mixed together, that maybe the dropout kid is making their lookalike tablet like you had up there, and I don't know which one my mom is getting to treat her. So yeah. Did I answer your question?
Yeah, that's
Okay.
Perfect. Yeah, that I put you on the spot, so thank you. So if someone gets in a situation where they are misusing and they are in a bad spot, not all hope is lost. So in Harvey County, what resources have you seen or are you aware of that someone can pursue to get help in that situation?
So we work with several facilities that specialize in the treatment. And so we work with here in town, Fear Inc., Prairie View. We work with Valley Hope up in Mountain Ridge, and we serve as their pharmacists to help, because when someone is recovering from the addiction, there's a lot going on with their body. Mm-hmm. And so sometimes we're treating other symptoms that are happening because their body has basically become dependent upon this, and that was its only focus. And so it completely forgot to take care of everything else. And so as we're removing the drugs that they've been abusing, we're trying to help get their body back to the way it should be. And so it's really important that that someone gets help with this, because it's very, very difficult to do it on your own. And so there are, healthcare professionals that are trained to help get you through that. And another good resource is just your primary care physician. A lot of times they can help you. It depends on where you're at, but they can either help point you in the right direction. They know the questions to ask you to figure out where you're at and really help guide you to getting healthy again and taking your life back. So
I got this at one of our drug-free youth coalition called is probably, is it backward?
It probably shows, right?
Teen Intervene, and it's through Mirror. And Manny Perez, Prevention Specialist. So, you know, there's a little resource right here.
And we're kind of, I mean, I think she covered, Sandie covered pretty much everything that, you know, Mirror Incorporated and there's some other, I mean, and I think of Mirror because they are stationed right here in Newton. I mean, their main headquarters are here in Newton. So that would certainly be a resource. We have the community chaplain response team. They have a peer mentoring program now that's really, it's going to be very beneficial to folks in our community. They just recently started drug court. I say recently, it's probably going for a year now or so.
About our first graduate.
Yes, yes. So that's a good thing for the folks that, you know, sometimes though that's, I mean, that's court ordered treatment, maybe, you know, maybe we don't want to get that far. So if we get them one of these other outlets before that happens, and I always talk about our role as law enforcement in the community is, you know, we're down here typically downstream, right, pulling people out of the river, but what we need is more help upstream, right, so that they're not getting to us, and that's where we talk about Mirror and some of those things. And you know, we're always, you know, our job as law enforcement obviously is to take care of these folks at that level, but I am very supportive of trying to get folks help upstream from what we're doing.
Sure.
And I'm so thankful for the STAND organization and Mirror and all the people that have kind of partnered together in this community, because really you have to catch this at the young ages of elementary school, you know, and junior high at the very latest, because even by the time they get to junior high, a lot of time it's too late. And to me, the very best interaction is peer-to-peer. You know, if they can encourage each other that way, and obviously educating families, because parents have to know what their kids are doing. You know, they have to be paying attention to what's going on. And so educating parents and helping our youth make good decisions from early ages is, to me, where we're going to win the battle.
I heard a really cool thing at the Drug Free Youth Coalition meeting. I think it was not last month, the month before. I never thought about this before. It was actually one of the, I don't know if she's a case manager or what her role is, but it was for kids that had gotten into trouble, and then their families would come in and do counseling with her. And she said that one of the things that she will ask the family to do, or she'll ask the kids, is she'll say, you know, well, you broke the rules of your family. You know, why did you break the rules? And the kids will respond and say, we didn't have a rule in my house that said that we weren't supposed to drink alcohol, or there weren't any rules. And so she noticed this pattern. And so then she would ask the parents, you know, well, let's just sit down here and what exactly are your rules? And for someone like me that like loves rules and likes boundaries, because, you know, I'm a pharmacist and like black and white, I was really shocked that she said that a lot of families have trouble making rules and making boundaries. So if you're a parent out there and you're listening, tell your kids the rules. So I went home that night and talked to my 14-year-old, and I said, let's just get this straight. The rules in our house are, you are not 21. You will not drink alcohol. You will not use illegal drugs. You know, and we kind of went through, you will not smoke tobacco and went through what the rules were, which of course he rolled his eyes and said, no kidding, Mom, I know this, but I just wanted to make it clear. And so then in our group, we talked about just posting that on your refrigerator. The rules in this house are that we don't drink alcohol if we're not 21, or maybe we don't drink alcohol at all. It just depends on but you have your own house rules and maybe some other things too. And I was really surprised to learn that for some people that could be hard, but since hearing that, I've paid attention to some of the patients that, you know, we're going through this walk of recovery with, and rules really are hard. So, you know, sometimes when you're working with your elementary age kids, maybe it's not even that you're talking about drugs and alcohol. Maybe you're just talking about being able to set boundaries and make rules, and that maybe simple little things like that, we can help families. So, yeah.
Great advice. Well, that is the end of our formal questions. You guys have done awesome at sharing such important content and just great information on this topic and really important details for us all to be aware of. Are there any final thoughts or reflections or things that we missed that you've thought about coming into this? It's okay, you say no. Well, we really appreciate the time. These folks are volunteering their time today, so we're really grateful that they took time out of their busy work days to be here and share with us for the benefit of parents in our county. So thank you. And we hope that we can all continue to work together to make it a safe place to live and work and play. So
Thank you.
absolutely.